Assalamu alaikum. Assessment of patient with dental implant. Introduction. Dental implant هي عبارة عن surgical component that interferes with the bone of the jaw or skull and must support the dental processes مثل الcrown والbridge والdenture facial processes. إذا أنا إذا أعوض في الميسنج تيث يعتبر dental implant هو أحد طرق التعويض لهذا الميسنج تيث. بنسوي patient assessment. The patient undergoing implanted dentistry should be successfully healthy to be able to withstand the oral surgical procedure. أقيم البيشنت من ناحية إذا هو أدى adequate space. Use of dental implant require that there should be adequate space in the jawbone to insert the device. Implant are typically تكون طول مالتها من 10 إلى 20 ملم long والwidth مالتها يكون 3.5 إلى 4 ملم بالwidth and must be placed with a margin of all تكون at least 1 ملم of the bone all around. Thus defining the surgical space envelope. While shorter implants are available, their reported failure rate ما يكون أكثر أو أعلى من long devices. من أقول إنه أنا محتاج إنه space مو بس معناته إنه أدي bone كافي أو outline مال bone كافي وإنما أيضا لازم internal structures that must be avoided when preparing the implant site. These include the tooth roots, the ear sinus, والnose والneuromuscular bundles such as the mandibular canal. ثاني شيء أقيمه هو الأكسس. Successful placement on the rotation of the dental restoration of the dental implant require there should be space, especially محاذ الأوكلوزال على مود إنه يصير عندي مجال إنه insert the necessary implant necessary implant will manipulate the various components required for implant placement and restoration. حالة إنه أنا عندي posterior teeth إذا كان عندي over erupted opposing teeth ممكن مو كل الحالات إنه أقدر أسوي له أحط له implant بهاي الحالة. ثاني شيء أقيمه هو الأورال hygiene. Effective dental plaque control يكون يعتبر pre-required لل successful implant therapy. A detailed description of the patient brushing technique with type by professional support therapy must be reviewed to correct إذا كان عنده خلل بالأورال hygiene مالته. لأن إذا كان عندنا inadequate plaque control has a significant impact. ممكن ينتج لي early implant failure in partial dentures patient مثل ان البكتيريا contaminated يصير اثناء السيرجري او يصير عندي excessive bone loss around the osseointegrated implant even in a dentural patient او يصير عندي peri-implantitis. رابع شيء ممكن اسوي له assessment هو البروكسيزم. Although this is يعتبر هو controversial issue, the trend is that the excessive occlusal loading increase the risk of the mechanical complication مثل ان prefabricated component أو technical complication هي laboratory fabricated and failures. Despite this, البروكسيزم إذا ما كانت هو extreme cases ما يعتبر هو contraindicated بس لازم إنه آخذ any precaution is recommended بهاي الحالات for selection of the implant while operation of the restoration design. History of tooth loss. The origin of the tooth loss must be stated as it can compromise implant success or complicated dental implant placement. In endodontic infection or endodontic surgical failure, in cases of the incomplete debridement of the lesion, ممكن تجني latent inflammatory or infectional process may remain in the bone even after several years. This lesion is not always advisable or observable on radiograph if not previously suspected and can interference ممكن تتداخل أيضا ويا الإمبلانت. هاي بحالة إنه عندي endodontic infection أو endodontic surgical failure نتج عنه فقدان السمع. ثاني سبب هو إذا صار عندي root fracture may be related نتيجة للexcessive occlusal force مثل عندنا paroxysm أو occlusal disorders من يصير عندي vertical fracture بالروت راح ينتج لهذا substantial alveolar bone loss ورا extraction. The traumatic bone loss and traumatic surgery will result in large alveolar ridge defect and gingival scars. Bone and graft soft tissue reconstruction should be considered. In terminal periodontitis, after tooth extraction, periodontal bone loss and soft tissue migration limit the amount of the available bone and damage aesthetic outcome. For patients with extensive care, the care is تعتبر في direct influence على implant success rate. The age of الدنتشولزم negatively influence للبون فوليوم. للدنتشولز patient removable denture أيضا يسرع لي البون resorption. Dental inflammatory or infectious process. Implant site. Although an implant placement in uninfected site does not affect the osseointegration outcome, delayed implantation is recommended to the extent possible. The adjacent teeth. Infection and inflammatory processes within the jawbone in the vicinity of the integrating implant, the apical lesion, the root remnant, the endodontic material can interfere with the osseointegration. They must be treated separately before implant placement. البريودونتال history. untreated periodontitis is a contraindicated أو contraindication للإمبلانت ثيرابي والأشخاص أو البيشنتس اللي عندهم history of treated periodontitis يصير عندهم زيادة بالrisk of implant failure and peri-implant bone loss. The patient at risk for dental implant failure. من ناحية الage, there is no upper limit in term of age, and old age alone should not be a limiting factor for the dental implant therapy. At 10 years, the implant survival of elderly patients اللي هم عمرهم أكثر من 65 years يكون 91.2%. As a general rule, the lower limit for implant placement يكون 19 years. ثاني risk factor اللي هو smoking. Smoking has been identified as an independent risk indicator for implant mucositis. Smoking increases failure rates and the risk of the post-operative infection as well as marginal bone loss. There is strong evidence that smokers are at higher risk for the peri-implantitis than non-smokers. والراديوغرافيكال يعني يصير عندهم أكثر peri-implantitis ويصير عندهم radiographic marginal bone loss than non-smokers. However, the majority of studies report implant survival تقريبا 18 إلى 19% in smokers. There is some evidence for a dose effect of cigarette smoking. يعني ماكو حالات إنه الدوز مال smoking هي اللي تأثر لي إذا كان implant أو لا. ثاني شيء هو history of treated periodontitis. There is evidence that the history of treated periodontitis increases the risk of the peri-implantitis. The risk ratio for failure in patients with aggressive periodontitis يكون higher than the patient اللي هم يكونون healthy أو يكون عندهم chronic periodontitis. Implant survival rate يكون range مالتها من 49 to 100% in patients who have regular periodontal maintenance. However, the majority of studies report high implant survival rate. The number of teeth. The number of remaining teeth on the opposing unit being a removable partial denture or nothing has been shown to be risk indicators for implant failure. In ectodermal dysplasia, studies indicate lower survival and success rate in the maxilla than in the mandible. The implant survival rate تكون vary between 99.5% and 97.6%. Implant placed in a patient younger than 18 years old have a higher risk of failure. البيشنت اللي عندهم AIDS أو عندهم HIV several cases report have been successful dental implant therapy بال HIV positive. البيشنت اللي عندهم diabetic أو hyperglycemia, there is evidence that diabetic patients increase the risk for peri-implantitis but not for peri-implant mucositis. A significant small difference between diabetic and non-diabetic patients concerning marginal bone loss has been shown. فيفضل لل-non-diabetic patients. البون disease. Severe bone disease مثل أن Paget's disease of bone, rheumatic arthritis, osteomalacia, osteogenesis imperfecta has been considered a high risk factor. There is no evidence for higher failure rate and complication بالأشخاص اللي عندهم osteoporotic patient. The major problem is associated with the use of bisphosphonate in these patients. Nevertheless, the intake of oral biphosphonate does not influence short-term implant survival rates. نقدر على short-term survival rate. Radiotherapy. A similar failure rate has been shown for implants placed after radiation and those placed before radiation. Local risk factor. The implant stability. The primary stability of the implant is a critical factor for implant survival. Several methods and devices are used to measure implant stability, including subjective evaluation, resonance frequency analysis, and insertion torque. From a clinical point of view, insertion torque value is routinely used. إكثر شيء يعني وايد تستخدم torque value. The surgeon should strive to achieve the high insertion torque value whenever possible. هي تكون هي 35 cm. The bone density. Bone quality must be considered. Bone density is measured according to the histological ومن ناحية morphometric analysis. Bone quality can only be evaluated by radiographic examination and confirmed during preparation of the surgical site. The interproximal space. The critical factor influences the position of the interdental papilla surrounding the implant. بين التوث والإمبلانت وبين implant وإمبلانت. Tooth implant, the risk of proximal bone resorption increases when the distance اللي صار بين implant shoulder والadjacent tooth تكون أقل من 1.5 ملم. المسافة اللي تكون بين التوث وبين adjacent implants. إذا كانت أقل من 1.5 ملم هسه عندي proximal resorption. In aesthetic area, this lack of bone support may compromise papilla preservation in narrow spaces. This risk can be prevented when the use of the narrow implant. A decreased implant survival rate has been reported when the implant is placed too close to the tooth. The implant 3 mm horizontal distance between two dental implant shoulder is the minimum required to preserve soft and hard tissue loss. هنا بهاي الصورة هنا عندي loss of papilla نتيجة لأنه مسافة صار بين التوث والإمبلانت تكون قليلة. وهنا هم ال proximity of the between tooth and the dental implant بالصورة B. Infected site. Dental implant should be placed in non-infected site. The implant site cannot be considered as sterile. Then microorganism may be persist with trabecular bone. Therefore, site of the neighboring teeth with the endodontic pathology or extraction site of infected teeth considered risk of successful osseointegration. The risk can be prevented by through examination of radiograph prior to implant insertion. The vitality of the neighboring teeth should also be evaluated. There is no detectable difference between the percentage of bone to implant contact for immediate implant placement in infected versus non-infected extraction socket. 92 100 survival rate at 12 months. Soft tissue thickness. A thin tissue biotype decreases the risk of recession. Pre-implant recession are dependent on bone thickness surrounding the implant body as well as the three-dimensional position of the dental implant. The presence of the keratinized attached pre-implant mucosa poses a challenge question in the health maintenance of the pre-implant soft tissue. It seems that increasing the soft pre-implant tissue is advisable in order to limit the marginal inflammation. Nevertheless, there is no evidence to support soft tissue thickness as a risk factor in implant survival. The keratinized soft tissue. It is often recommended that dental implant be surrounded by keratinized tissue to improve long-term survival on implant. There is no evidence that increasing the width of the keratinized tissue improves the long-term prognosis of the dental implant. However, inflammation and plaque accumulation are greater إذا كان الكeratinized mucosa width يكون أقل من 2 mm. No correlation has been found between the peri-implant mucosa width and the marginal bone loss. Thank you.